Hello and welcome to today's gossip. Today, we have some sad news to share about one of Hollywood's most beloved actors. The family of Bruce Willis has announced that he has been diagnosed with frontotemporal dementia, a form of dementia that affects the frontal and temporal lobes of the brain. Let's take a closer look at this devastating disease. Frontotemporal dementia, or FTD, is a cruel disease that can strike anyone. It occurs when nerve cells in the frontal and temporal lobes of the brain decrease in number. Bruce Willis, 67, was previously diagnosed with aphasia, which prompted him to retire from acting. There are two main variants of FTD: primary progressive aphasia, which hampers a patient's ability to communicate, and behavioral variant frontotemporal dementia, which manifests as personality and behavioral changes. FTD is the most common cause of dementia for people under the age of 60, and there are roughly 50,000 people in the United States with a diagnosis of FTD, although many experts consider that number to be a vast undercount, because of how challenging it can be to diagnose. Those with the behavioral variant of FTD may act out of character. Families will say that patients seem like they've lost a little bit of their filter, according to Drive. According to Dr. Ian Grant, an assistant professor of neurology at the Northwestern University Feinberg School of Medicine, someone who is typically quiet and reserved may start spewing profanities, for example, or loudly comment on a stranger's appearance. People with FTD often struggle with organizational skills, failing to multitask or plan. Frontotemporal dementia can also manifest in excessive gambling or impulsive spending. FTD is a cruel disease that can cause poor judgment and erratic behavior, such as drinking an entire bottle of maple syrup, according to Dr. Grant. In some cases, patients may be misdiagnosed with a psychiatric condition, like bipolar disorder, because of these symptoms. Genetics are a critical risk factor for FTD, but beyond that, doctors aren't sure what causes the disease in most people. There is no cure, but there are treatment options that can help manage the symptoms. Occupational therapy and speech therapy can be tools to help patients who have difficulty communicating. Physicians often work with the families or loved ones of people with FTD to develop a care plan, which can include safeguards to make sure they cannot hurt themselves or their loved ones. Doctors may prescribe medications to help manage the symptoms. Some patients may be prescribed antidepressants to cope with mood or behavioral symptoms. FTD is a devastating disease that affects many people and their families. While there is no cure, there are ways to manage the symptoms and help those affected, like Mr. Willis, live their lives to the fullest. We wish Bruce a healthy life and hopefully we'll see him back on screen very soon. We hope that through awareness and continued research, we can better understand this disease and work towards a cure. Thanks for watching today's gossip, and don't forget to subscribe, like, and hit that notification bell so you don't miss out on our latest updates.